Dr. Regina Rodman here, and we are going to talk today about some of the risks of fat grafting. Now, I do a lot of fat grafting in my practice, especially for cheek augmentation. I'll put a little bit in the temples sometimes in the lips as well. Now, the risk with fat grafting is that it is very variable in how much of it takes. So, unlike filler, where kind of what you see is what you get, fat, we inject it, and somewhere between 50 to 70% of it lives. Some of it will almost always be absorbed by the body. The problem is, I don't know if you are going to be a 50% or a 70%. So I always over-inject a little bit because I know some of it's going to get absorbed. But if you end up being the 70% and we overdo it a little bit, 70% will be just right. If you end up being a 50% or maybe even a like 30 or 40% person, then you will probably need a second round. So what I tell people about fat grafting is it's a great procedure. And also I should note, at 6 months, that's when we're able to know how much of the fat actually is retained. At 6 months, whatever is still there will stay forever. And so that's the advantage of fat grafting over fillers, is that it is permanent. What does stay there will last forever. However, not all of it stays. So what I tell people is if you're considering fat grafting, plan on it being a 2-step operation. So we would do one kind of big grafting where we distribute a large amount of fat. Let's just plan on a lot of it not taking, and let's plan on needing a little touch up. If you're one of the people that it takes and you like the shape and it stays, then that's great, then we win. If you're like most people want a little bit of a touch up. Maybe one cheek took a little bit more than the other, or maybe only 50% of it took and they want fuller, bigger cheeks. In that case, we can do a second procedure. And usually the second procedure is just a touch up. And so that is possible to do in the office just with local anesthesia. So I tell people, think of it as a 2-stage procedure. They tend to end up a lot happier than if they think it's just a one and done. So that's really not so much a risk, but just like an important fact to know about fat grafting is that it varies in how much actually takes. Other risks with fat grafting is that there's always a risk of asymmetry. I've talked about this before. The two sides of the face grow up like sisters, not twins, and so nobody has a perfectly symmetric face. So one side will almost always retain a little bit more than the other, usually the side that actually has a little bit less volume because there's less muscle movement, but it can vary. It can vary by which side you sleep on, how you move your face when you animate. It can vary by a lot of different things. So there probably will be some subtle asymmetry that can be touched up either with a little filler or with a little touch-up fat grafting procedure. The other risks are all actually pretty minor. There has been described a risk of a fat embolus where some of the fat gets into a blood vessel and actually travels. This is possible, but unlikely. I do use a slightly bigger blunt tip cannula. So it's unlikely to get into a vessel, not impossible, but unlikely. Also really mindful about where I'm distributing the fat. I go nice and slow to make sure that we're not sending a pressurized molecule into a vessel. The other risk, fat grafting really is intended mostly for the cheeks and then sometimes for the temples. I will often, if patients request, I will put some in the lips, but patients should know ahead of time that fat does not stay very well in the lips. Fat grafting stays well in places that already have fat. So that's like the fat pads in the cheeks, the fat pads in the temples. The lips don't actually have natural fat pads. And so the fat does not stay as well there. It's certainly, if you are already asleep, you're already getting fat grafting and you want to try to put a little bit in the lips, I absolutely will. But that is not something that I guarantee because that's really variable in how well it takes. Also, our mouth is super active. It's moving all the time, talking, drinking, eating. And so just the metabolism of that area is higher. And so the fat tends to not stay as much. I tell patients if they're considering it as a let's just try, and if some stays, great. If not, I understand, that that's the risk I'm taking. if patients seem to understand that, absolutely we can do it. If patients are concerned and they want a more definitive approach, something like a lip implant, a lip lift, or lip filler is probably a better solution. So that's the major things that are important to know about fat grafting.